Today, we are diving into a really powerful toolkit for anyone who works with kids in a healthcare setting. We're talking about a fundamental shift in thinking, how to give children back a sense of control when their entire world feels totally chaotic. So, let's jump right in. Okay, so we've all been there, right? A child is refusing care, they're crying, or they're just completely shutting down. Now, the old way of thinking just focuses on the task at hand, but I love this iceberg visual because it tells the real story. That refusal we see on the surface, that's just the tiny tip. Underneath, that's where the real stuff is happening. We're talking about fear, a massive loss of control, and a brain that has flipped into survival mode. So here's our game plan for today. We'll start by looking at what we typically see on the surface. Then, we're going to get into this core idea of shifting from doing to a child to doing with them. After that, it's all about the practical stuff, the My Care, My Way menu, and other awesome frameworks. We'll even tackle what to do when you hit that wall of resistance. And finally, it will wrap up with the huge impact all of this can have. Right, so traditionally, when we see resistance, our brain immediately hones in on just getting the task done. We might label the child as non-compliant or difficult. But that perspective, it completely misses the why behind the behavior. It's like staring at the tip of that iceberg and completely ignoring the massive, powerful force lurking just beneath the water. And that leads us to the single most important idea we're going to talk about today. It's the shift from doing to a child to doing with a child. Now, this isn't just about being a little nicer. No, this is a total change in the power dynamic, and it's really the foundation for every single tool we're about to cover. So here's the bottom line. Especially in a really high-stress environment like an ICU, partnering with a child isn't about letting them call all the shots. It's about giving them back their sense of self. I mean, think about it. When every part of your day is decided for you, shared participation is one of the only ways you can feel like a person again, and not just a patient in a bed. All right, let's get into the nitty-gritty. Our first practical tool is called the My Care, My Way menu. It's such a simple concept, but it's incredibly powerful. It's all about standardizing how we offer choices to give kids back that feeling of control. Honestly, it's a total game changer. First up, let's talk about the environment. Just imagine how threatening a chaotic, loud, bright room can feel to a kid who's already scared and vulnerable. By offering simple choices, lights, sound, even privacy around their own bed, you are immediately turning down their body's threat alarm. You're sending a crystal clear message. You matter, your comfort matters, and we respect your space here. Next, let's talk timing. Now, obviously, some things are medically urgent, but a lot of tasks have some wiggle room. Just asking when a child wants to do something shows that you respect their rhythm. It acknowledges they have a life with favorite TV shows and family visits that exists outside the hospital schedule. It's a small thing that gives them back a little piece of their normal life. In this right here gets to the heart of it. During a procedure, a kid can feel completely and utterly powerless. But giving them a real job, even something as small as holding the gauze or being in charge of counting down from 3, it transforms them. They go from being this passive object that things are happening to being an active, important member of the team. That's how you restore their sense of agency. Okay, building on that menu idea, let's look at 2 structured frameworks. These are designed to help you build that trust and partnership right from the start of a shift, and especially during those really tough, stressful moments. Just imagine starting your day with this. In 4 super quick steps, you set a totally different tone. You're not just a nurse, you're a team. You're anchoring the medical stuff to their personal goal for the day. You're getting ahead of the hardest moments by making a plan, and you're giving them an escape hatch with a communication signal. You're building psychological safety right from minute 1. And for procedures, there's the one voice model. Think of it as a checklist for compassionate, trauma-informed care. It makes sure there's one clear person talking, the child is prepped, their feelings are validated, the whole shebang. It basically creates a bubble of predictability and calm in what could otherwise be a really scary situation. But let's be real. Even with the best plans in the world and the most collaborative attitude, you're still going to hit those moments of resistance. A child is just going to plant their feet and say no. So, what do you do then? This is that critical moment, isn't it? This is where the old approach just completely falls apart. The child is stuck in a refusal loop. They've hit a total wall. So how do we move forward without making things worse, without escalating the situation and causing even more trauma? The answer is the 2-minute reset. And this is such a powerful de-escalation tool. First, you stop everything. You physically get down on their level. Then you validate what they're feeling, 100%. I hear you, this stinks, you're done, I get it. Then, and this is key, you pause for 2 whole minutes. No medical talk at all. And the re-entry? You state the non-negotiable, for safety we have to do this, but you immediately hand the power right back to them. But how we do it is your choice. You know, our words have so much power. Just look at this. Little phrases like "you're fine" or "be a big girl," they can feel like a total dismissal of what a child is experiencing. They actually break trust. But the alternatives on the right, they do the opposite. They validate feelings, they empower, they give concrete information. This is literally how you build trust, one sentence at a time. So let's pull back for a second. We've talked about all these tools, menus, checklists, resets, but why do these seemingly small adjustments have such a massive impact? Let's look at the big picture here. Of course, the primary goal is always a safe medical discharge. But as you can see here, there are these other huge, crucial goals. We need to prevent kids from regressing developmentally, we need to actively reduce medical trauma, and we need to help them hold on to some sense of a normal life. And every single tool we've just discussed, it directly supports these secondary goals, which are just as vital for a child's long-term well-being. And that really brings us to our final thought. It all boils down to this one question. We can never, ever underestimate the power of giving a child one small, real choice. Whether it's choosing a song to listen to, or being the one who holds the gauze, or deciding to take their medicine in 5 minutes instead of right now. That single moment of control can be the anchor that restores their entire sense of self and can transform their experience from one of trauma to one of true resilience.